During the COVID-19 pandemic, the mortality rate of our kidney transplant patients actually doubled from pre-COVID levels, and it was much, much higher than that of the general population. So I'm Mark Stegall. I'm a kidney transplant surgeon at the Mayo Clinic in Rochester, Minnesota. I'm actually the James C. Masson Professor of Surgery Research. I'm here to discuss an article that's coming out in the September issue of Mayo Clinic Proceedings. It's entitled Response of Kidney Transplant Recipients to Vaccination and Boosting. The study actually came out of our concern about our kidney transplant recipients across the 3 Mayo Clinic transplant programs during COVID. We actually looked at this retrospectively in another study and found out that the highest mortality rate was actually during Delta and Omicron, when actually the vaccines were already out. And what we found out is that people who were actually a lot younger than the general population, and it was kind of spread over many ages. And the people who were vaccinated prior to transplant did much better than the people who were vaccinated after they had already had a kidney transplant. The current study that's coming out in Mayo Clinic Proceedings is looking into the reasons behind that. We actually did a couple of things in this study. We looked at antibody levels in patients after they had received 2 doses of the mRNA vaccines. These were antibodies against the spike protein of COVID, and we used that data to show that about 30% of the patients actually didn't really have good responses to the vaccine. And again, we found that the people who were vaccinated prior to transplant actually had pretty normal responses. And then we also looked at whether the patients who had a poor response were able to have better levels of antibody if we gave them a different vaccine, a heterologous booster, with the Janssen, which is more of a conventional vaccine, not an mRNA vaccine. And what we found out is that even though we reduced the immunosuppression in these patients around the time of the vaccination, that the patients who didn't respond just continued not to respond. And when we looked mechanistically, we found out that basically these patients had a damaged immune system. It had just never recovered or had been suppressed very, very low during their transplant and beyond. They had very low levels of lymphocytes in the peripheral blood and very low levels of certain T cell subsets. So we started thinking more in the future how to do things differently in our population based on the current study. This study was a basis for us having a couple of practice changes. One of the biggest ones was to make sure that we vaccinate immunosuppressed patients before they get their immunosuppression, if at all possible, because that's the best time for them to respond to vaccines. And then we started thinking long term about, well, if they're not responding to vaccines, they're probably susceptible to other types of infections and cancer. And so we actually looked at older patients, and we have a clinical trial that's going on right now trying to minimize the immunosuppression in older kidney transplant recipients, in fact trying to get them off of mycophenolate by a year. I think that kidney transplant patients going forward, if they're going to get a transplant, people who are recommended they get vaccines should get their vaccines before they get their transplant. And I think that right now, that's the best thing I can tell people. Many people do respond to vaccines even after kidney transplant, so there's not a reason not to get a vaccine. It's just that we think we can do better than we're doing now. So I think we're learning a lot more about what happens to the immune system in kidney transplant patients, and certainly going forward, we're going to be much more careful how we vaccinate patients. And so I hope that this article will be interesting to you, and if you have any questions, you can contact me.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings. Our journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research. published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.